Good afternoon. My name is Jason Medford. I am a member of a ACT team for CODA in Toronto. I am your moderator today, and I will be hoping to make these presentations move as smoothly as possible. I'll say it again, welcome. I will be reading the land acknowledgement first before we get started. Start first. The 2024 National Conference for Ending Homelessness is being held on the traditional unceded territory of the Anishinaabe Algonquin peoples. The people of the Anishinaabe Algonquin Nation have lived on this territory since time immemorial. The culture and presence have been nurtured and continue to nurture this land. We acknowledge and celebrate the many First Nations, Métis, and Inuit peoples from coast to coast to coast who participate in this conference and lead the work to end homelessness across Turtle Island. Okay, so I'd like to introduce Misty, Tammy, and Leigh. They will be our presenters today. I will be giving a brief bio on them as they present. Misty, I believe, is the first one for us. I will just quickly. Misty Schofield is the HOPE team coordinator. Misty brings a combined lived experience and education to the role of our HOPE team. She is a BA in Law and Justice from Laurentian University and a Bachelor of Social Work from Dalhousie University. A registered social worker in New Brunswick, her passion for supporting participants is balanced with her desire to be part of creating systemic change. As a proud Red River Métis woman, she is a fierce advocate for social justice and a strong believer that participants are experts in their own lives. Misty is a voracious reader and can be found on her downtime in lands far away, cuddled with her dogs in her hammock. Thank you.
So my ED is going to come up first just to introduce our organization.
Hi, everyone. So I'm panel crashing, first time ever. So my name's Melanie. I'm the Executive Director of Fresh Start Services. We're a small nonprofit that sadly is growing exponentially because of the homeless crisis, but we've been on the street since 2009, and I thought I would set the stage a little bit for Misty's presentation. They're all hanging around here. What am I doing? Am I doing well?
No.
Oh, okay. Okay, sorry. And so one of the things, we started a journey way back in the Harper years. Got 6-year pilot funding for a Housing First pilot for women engaged in sex work. So at that time, there were about 60 women actively participating in sex work in St. John. And so we come in, we're going to do this. And of course, under the Harper government, the idea is if we were successful, they would exit sex work. And so we went into it and said, you know what? Why do they need to? What right do we have to tell them that in order to be housed, you can't do that? And then went a step further and said, you know what? We're going to house them with the expectation they are going to do sex work. So we purposely found apartments that would meet that need. So we wrapped up that program in 2019 with an 87% success rate. And those women are still housed today, most of whom have left sex work. Thank you. We didn't tell the Harper government of Canada. And so basically we're this little organization that does things we're not supposed to do, that people tell us not to do. And so I'm going to be inappropriate and set the stage just for all of you for Misty's presentation, because we decided a few years ago, fuck it, we're going to do it again.
Hi, guys. So I'm Misty, and I appreciate you guys all sticking around for this presentation, because if your evening was anything like mine, you are very tired right now. So I first want to tell you, I feel very short right now. I first want to tell you a little bit about how the HOPE team came to be. In June 2022, I was finishing a contract at a previous job, and I approached Mel about my idea. I had been housing people off the side of my desk, and I had really good stats. And at the time, it was Mel and Kristen, who now does Rent Bank, and they were kind of a force to be reckoned with in community. And so I approached them and told them that I wanted a team to house people in St. John, and that we wanted to house people differently than was currently being done. So over the next 2 months, we approached our community, and we asked our community through coordinated access to pick 2 people, both a male and a female, who they felt were unhousable or would be the hardest to house. Our community gave us names. And in August of 2022, we housed the first 2 participants of our program, who today are still currently housed. We did this on a volunteer basis, and we had some of the members of the team right now who are paid, at that time were volunteers. We also connected with other community organizations and people that wanted to see things done differently. And so at that time, we were doing the work for free. In October of 2022, I officially started at Fresh Start, and we were funded through Reaching Home. Currently, we have housed 56 people in St. John. We've had 1 eviction. That eviction was an eviction that we personally asked for, and it was because that individual was an immediate risk to life in that building. We've had 10 people successfully transition out of our program, and we have 45 current active service users. The one thing I want to point out that we do differently as well is I don't have a caseload of 15 people. My other team members do not have a caseload of 15 people. We all case manage the 45 people, and we share the information on house visits. And the reason why this is so successful is because each of us is on call 1 week. So there's 4 members of the team. I'm on call, somebody next week, somebody next week, somebody next week. And doing it this way allows it so that relationships are built with all of our clients, with all members of our team, and it kind of avoids like I'm free to come to this conference right now because nobody has to take over and not know what to do. So I want to tell you a little bit about my team. And I think that this is really important because what is different about my team is that every single person on my team has lived experience. So that was a wonderful bio, and I always kind of feel like an imposter when it's read, because I'll be honest with you, I'm a single mom of 3, I'm a high school dropout, I was a substance user, I've been sober for 19 years, I was also homeless. Sarah Graham, she's a housing support specialist. She's actually currently leaving my team. We do scattered site housing, and she is about to lead a single site with 18 units of trailers in St. John. But Sarah Graham, she has her own history of lived experience. Taylor Cole is the youngest in our team. She is also a single mom, and the girl does not stop working. Last but not least is Jenna, who you'll see in the audience. She's amazing. Jenna, she is our newest hire. Jenna volunteered her time while she worked a full-time job, after hours and on weekends. This girl has cleaned apartments. She has come to pick me up when my car is broken down and I've been on my way to clients' houses. She was Fresh Start before she ever became Fresh Start. This is a really important quote to me. I think that normally I'm not really the one that comes and talks to crowds. And typically that is for good reason. I swear a lot, and I'm not always as politically charming as others. I'm very blunt. Something that I think is incredibly important in the work we do, not only with ourselves and with other agencies, it's really easy to tell somebody else, you know, your program isn't doing very well, or your program needs to improve on this. But what's really incredibly important is for you to look at your own programs and look at the things you're doing. And if you're seeing patterns and trends in the things that are happening in your program, you need to ask yourself why that is happening, and you need to talk to your team about how to change that. So this is an intermediate presentation, so I'm not really going to go into what Housing First is. If you're in this room, I'm going to assume that you understand what Housing First is. And for the people that don't, I apologize. We just didn't get enough time, and I could talk for hours. So our program is a Housing First program. The only requirement we have of our service users is that they have to let us in the apartment. We're going into their apartments. That is the one non-negotiable. They have to let us into the apartments. It's super important that we understand that any single person that we have housed, we do not tell them what to do. If somebody is a substance user, my job is not to tell them to stop using those substances. If somebody is a sex worker, my job is not to tell them to stop doing that. If somebody has different methods of entrepreneurial modes of work, it's not my job to tell them not to do that. And so what we do is we creatively problem solve. So we build relationships with people in community. We have an outreach team, and we're often meeting those people through community and in community when we're on the ground. And so we've built relationships with individuals through coordinated access before they're ever prioritized for housing. And we keep an eye on who is prioritized for housing so that as units come up, we can, if it is somebody that we don't know, we can go and meet them and start to establish a relationship. So one of the most important things is to confront our biases. And I know everybody says, I'm really non-judgmental. I'm really easygoing. And, you know, I get it, because, like, poverty does a lot of things to people. Every single one of us, regardless of how good you are at your job, how open-minded you are, how liberal you are, we are all biased. I see it all the time myself. We see it with standards of care in apartments. You know, oh, this person isn't, you know, taking out their garbage. They're not doing this. They're not. We see it in communication when we're talking to people. You know, oh, the house was disgusting, like those kind of things. We are all judgmental, and it's super important that if you're having a reaction to something, you have to ask yourself why. Creative problem solving. Now, by creative problem solving, what we mean is that things are going to happen whether you want them to or not. And so creative problem solving, it devises ways to fix those. So if somebody's not taking their garbage out, and you're going to have those conversations like, why aren't you taking my garbage out, or your garbage out? And they're going to be like, well, it comes super early on this day. I'm never up that time. Okay, cool. What about taking it out like the evening before when you are awake? Like those kinds of conversations. But the other things that we do with our clients is that we'll just go with them. If it's garbage day, we'll go. We'll visit with them. We'll have coffee. We'll take their garbage out with them. If somebody is having difficulty getting their dishes done, we'll go, have coffee with them, hang out with them. I'll dry, you wash, those kind of things. Creative problem solving means helping people build that community to get things done. It's really hard in a city like St. John with the landmass we have to do, it's hard to be poor. If you don't have laundry in your building, going to do your laundry, that is a challenge. The bus system in St. John, it's pretty terrible. Having those rides in place, having connections, meeting people in community, once you build those connections, it makes it much easier to do the tasks that a lot of us take for granted because they are so easy. Sustainability. We never house people for the sake of housing people. I absolutely refuse to be like, oh, I have an apartment, I'm going to move somebody into it. If the apartment that I have or the landlord that I have is not a good landlord, not a good fit, There's absolutely no sense in moving somebody into that apartment or accepting that apartment. I know a lot of communities are really worried about, lack of housing, but I assure you that there are landlords in your community that will do this work, and this is the reason. Landlords will do what they can do to do the least amount of work. That is what we have found. So, how do we have such great landlords in St. John? Well, there was a really, really angry landlord one day, and I fixed his issue for him. And I fixed it very easily with the relationships I had built. And he thought that was pretty cool. And so I asked him, hey, do you have any apartments? And the cool thing about our program, you'll see some learned things, but one of the really cool things about our program is that we have a damages fund. And when I have conversations with landlord, I'm not like, oh yeah, we're going to move this person in here and it's going to be fantastic. I'm like, there are 100% going to be problems, but this is what I can promise you. I promise you that I'll fix them. I can't promise you I'll fix them overnight, but I assure you that I will fix whatever issues. So if a window gets broken, if a door gets broken, if you have to go ladle poop out of a toilet at 3 a.m., it gets done. So how we turn landlords into people that'll house anybody is we built their trust in us. We created good relationships with them. We did the things we said we were going to do. We did not promise to do things that we couldn't do. And we made their lives easier. Anybody that has dealt with subsidies and government programs knows how difficult those can be. Make relationships with those people in there, make landlord lives easier, you're in. Something else that we do is turning enraged neighbors into engaged neighbors. Right back to the judgment. A lot of people are really judgy. A lot of people don't know things. We see, everybody in this room has seen all the stuff that has gone on social media about the unhoused population all across Canada, right? People have judgment. People are scared. People are afraid of things that they don't know. So one of the ways that we turned enraged neighbors into engaged neighbors is that we give landlords our on-call phone number. And we tell those landlords, if anybody has any issues, you can give them this number. We will show up 24 hours a day, 7 days a week. The greatest thing about this is that, significant, I would probably say the majority of calls that we get is a neighbor who sees something, makes an assumption and a judgment, and they see us. They see us show up. They see us show up within 10 minutes. They see us go in that apartment. They see us leave that apartment. This happens with every single person we house for at least the first 3 months. There are numerous complaints. There are people calling that number. And as time goes on and people know that somebody is going to show up, they get more confident. They get less scared. They make less judgments. And that has turned neighbors who do not want homeless people in their buildings into neighbors that just think that they have other neighbors that have support. It's been really cool. Okay, so I'm running out of time. Lessons learned. Don't be afraid to fire landlords. I know over the last day and a half, I have seen and heard from all the rooms that I've been in how tired everybody is. The work we do is friggin' hard. Society is not taking it easy on us. Our communities are not taking it easy on us. Governments, they have a lot of expectations. Funders have a lot of expectations. There is so much red tape and stuff that you have to kind of move around that it's exhausting. And from what I'm getting from this conference is that I really feel like I really have it lucky in my community because we've worked really hard to change some of the rules. And so while I understand that and the housing, lack of housing, I want you to know that it's super important to not feel like you can't fire landlords. In St. John, when we first started this program, we had one landlord in St. John that pretty much worked with subsidized units, and we weren't getting any subsidies, like to the point where at the beginning of this program, I was like, there's no way we'll be able to meet our funded obligations. But I went to the community and told the entire community that I was not going to work with that landlord. I absolutely refused to work with that landlord. And the reason for it is because it was setting my clients up for failure. It was extra trauma, and I refused to do it. I now have every single one of these clients housed with different landlords. Getting landlords was easy because landlords talk to other landlords. And once you have a really good relationship with a landlord, they're going to tell their friends. They're going to tell those Facebook blacklist groups. And they're going to say that you save them work and time. Damages pot, super important. When we first house people, it's not necessarily the people you house, but the people they know. We had an individual whose windows were broken. 5 windows broken 3 times in a row. Damages pot was super important. That landlord, I am his favorite person in the entire world because he didn't have to do anything. Those windows just got fixed. Housing people together but separately. If you see people are being prioritized and you know somebody is in a relationship with domestic violence, you 100% know that that person is going to be in the house. It's going to happen. So what we've done in St. John is when we're housing somebody that is in a volatile relationship with somebody, we house them together, but in different units. And they can spend as much time as they want to with each other at their units. However, when things pop off, which they will, you can send that person home. You can go pick the person up, separate them from the situation. They don't have to go to the shelter. They don't have to stand on the street. They can go home. Also, if you have people, groups of people who like hang out all the time, who are really good friends, who tent together, that sort of thing, it's also super important to house those small groups together because they are going to be staying at the person's house who is housed if they are not housed. So it's important to recognize relationships that people have built because that's their community. Electronics lock versus keys. The number one expense that we have is replacing keys. So my best advice is to do electronic locks. And the reason for that is because you can always change the code because they're going to give it out. And the other thing about that is there can be a master code for all of them. So we started with like keychains that kind of look like your jail guard. Those didn't work out so well. And we went to this big book and that was really difficult. So what we started doing is if we have to replace a lock, we will replace it with the keyboard one. Excellent. Have people you know that can fix things. Don't rely on the landlord. If your client breaks a window, get a window guy. Fix the window. Know what your limits are. Don't try to do electrical and stuff like that you can't do. But there is basic stuff that I assure you can do. And that is why we say get a YouTube dad. There's this really cool YouTube channel. Teaches you how to fix basic stuff. You need to caulk a tub. You need to like replace, door jamb, that sort of thing. YouTube dad, he's the best. Lastly, if you're a landlord or you know landlords or they're asking you any advice, no to low flow toilets. Because people who experience poverty, they cannot afford the great flushable toilet paper. They're using Tim Hortons napkins. They're using flushable wipes, which are absolutely 100% not flushable. Make sure that it's one of those things that it's going to happen. It's going to happen at every unit that you have low flow toilets. There are other ways to save water, I assure you. And lastly, contractor garbage bags. Do not chimp out. Do not go and buy the cheap bags from the dollar store. Just go buy the $50 bag of contractor bags because they're not going to rip. When you're going down the stairs in the middle of winter and you slide down those stairs and that bag comes down with you, those contractor bags, they're going to hold up. I've left my contact information. Thank you very much for your time.
Thank you, Misty. Thank you. That was great. The low flow toilets. I never knew how much I needed those. Okay. Yeah. Oh, we don't need those. I don't need those. But I have seen that in my. That's great. So now I'm going to introduce our next presenter, Tammy MacFarlane. And I'll just give you a little bit about her. She's the Director of Clinical Services at Saskatoon Crisis Intervention Services. Tammy is a mother of 2, is a registered social worker who holds a master's of social work from a degree from Dalhousie University. Tammy has worked at Saskatoon Crisis Intervention Service for almost 14 years and has started her career as a crisis worker. Tammy has worked in all programs at CSIS, Mobile Crisis, the police and crisis team, the intensive community support and a housing first assertive community treatment team, and working with 2 streams of service scattered sites and permanent supportive housing. In her current role as director of the clinical services, Tammy is passionate about ending homelessness, outstanding interdisciplinary practice and partnerships, and working within innovation solutions. Thank you, Tammy.
Yeah, please.
There we go.
Well, thank you. It's nice to follow Misty. She's a champion in this work. It's very exciting, all the things that you're doing. And I think that the information that you provided about how to build landlord relationships is really something we need to hear a little bit more, that it's not so easy, but that those relationships really have a big impact. So thanks for that. So yeah, I'm Tammy MacFarlane. I'm from Saskatoon, Saskatchewan here. I'm going to do a presentation on successful outcomes through partnerships, but first I'd like to start with my own treaty recognition. So before I start my presentation with the goal of learning on how we can strengthen partnerships for better outcomes, I want to share that I'm not Indigenous. Rather, I'm a settler from colonial ancestry from Scotland and the Czech Republic. I was born in Lawrence, Saskatchewan, and like many other settlers, I've benefited greatly from living on my homeland where I get to work, be a mother, and play of Treaty 6 territory, a traditional meeting ground, gathering place, and traveling route of the Cree, Dakota, Nakota, Saulteaux, and the homeland of the Métis. I acknowledge all the many First Nations and Métis Inuits whose footsteps have marked all these lands for centuries. I recognize that colonialism is a current ongoing process, and as a registered social worker, I recognize that my profession has directly harmed Indigenous peoples and communities through supporting the implementation of residential schools, upholding discriminatory policies within the child welfare system that led to the 60s scoop, and the continued inequalities apparent in the field of social work. As a settler, I take responsibility to actively engage in reconciliation and decolonization. I support the mission and vision of Saskatoon Crisis Intervention Service as we continue to develop and implement our programs, Mobile Crisis Service, the Police and Crisis Team, and Intensive Community Support, which also includes Kikanak Village, our home. I also recognize the peoples of the Anishinaabe and Algonquin Nation whose culture and presence have nurtured and continue to nurture this land that I get to stand on today. So I really appreciate you folks taking the time to stay till 3:30. Whew, a busy day. So I do have 3 learning objectives that I hope that we will gain a better understanding on how we can improve our service delivery through partnerships and meaningful partnerships. So I have attached a 1-page summary to my materials around Saskatoon Crisis Intervention Service and intensive support. So I'm gonna go through this quickly, but hopefully we have time for conversation, which is my preferred way of doing this. So I'm going to start off with my first learning objective to talk to you about is assertive community treatment teams, and I'll do that by providing an overview of Saskatoon Crisis Intervention Service. Then I would recognize that we can talk about partnerships, and I would look for you to consider as we talk about that some of the champions in your backyard for better outcomes for what the clientele that we serve, which is deemed the hardest to house or the hardest to serve. I would say also the persons that we serve are not the hardest, but the systems that we operate in are probably the most challenging that they've ever been. And then I don't think that we speak enough about how hard it is to do partnership work. I think folks talk a lot about collaboration and partnerships, but I don't think they talk about how challenging it can be. And I think there are some traps, and I think there are some things that I've learned through this work that might get in the way of developing those collaborative partnerships and being smarter than maybe some of the systems that we work within. So I hope that we can learn a bit together through that. So an overview of our service provision. Saskatoon Crisis Intervention Service has mobile crisis service. So it's caring and professional crisis workers that are available 24 hours a day, 7 days a week, 365 days a year, by phone and as a mobile response. 60% of the contacts are from persons that are aged 12 to 38. We average about 68 crisis contacts per day. They average around 33 minutes per contact. And over the last year, we responded to 3,000 calls for service in Saskatoon. We land within what I describe as the psychosocial emergency of Saskatoon. So fire does what fire does, police does what police does, and Saskatoon Crisis does the human services work after hours. We are on everybody's after hours number when the crisis does end at 5 o'clock, as we all know. And then we respond to what an increased call volume of 500 calls over that last year. The calls have become, I don't know if the complexity has become more challenging, but definitely our climate and what we have access to has become more burdened than ever before. The other program that we operate is the Police and Crisis Team. So that's a specialized team with a police officer and a mobile crisis worker that are responding to help with mental health and addictions services. We view it as a least intrusive trauma-informed lens, so it's a co-response. We have those responses generated through 911. And the PAC team has assisted over 2,000 persons in mental health crisis. That's deterring 300 folks from emergency departments, which I think folks may need if they are getting to emergency departments because they need to be there. Otherwise, they're allowing for the crisis be managed with some care and attention and some follow-up. And then obviously diverting from any arrest as a backup for the criminality lens, that some police officers don't have any other options, so that's the only option they have. So we do have 4 PAC teams currently with our service, so we're running on each platoon A, B, C, and D. Now, one of my programs that I've been involved with for a majority of my career is the Intensive Youth Support Program, a Journey Home program. And so this is an assertive community treatment team. So and I do have some of my lovely case managers in the house representing that have been there for quite some time serving this group of persons. So it's an assertive community treatment team. We have an interdisciplinary team, so it's a primary case manager with a registered nurse. Obviously, this is evidence-based. We have always landed in, like Misty was saying, we want the list of those folks that people say that nobody can serve. That is the group of folks we want to serve and serve better. So they've been barred and banned from everywhere. Folks in our community say, we don't know what to do with them. It's impossible. And those are the folks that we get really excited about. Really, really excited about. Hey, Monica? Yeah. So we're very person-centered. We do whatever it takes. I have a really grindy group of folks that I get to work with. They're creative. We work in a nonprofit sector, so they get to be flexible. Care plans get to be wild, and some of our folks are wild and woolly, so it really matches and aligns. And we really our goal is long-term housing stability. We want folks to be successful in their own lives, not how we dictate it from our Western view, but from their own community-minded perspective of what that looks like, and give choice instead of options. So since 2014, Intensive Community Support has supported 175 participants in their recovery from homelessness. So partnerships, getting into the meat of this presentation, I don't think we can do it without each other. This is an example of the champions I found in Saskatoon that are really skilled in the work that they do. And I think it's recognizing where your best lies and where you can broker the best in other areas. So this is an example of our Kikanak Village, our home. So I have Camponi Housing Corp, which is an Indigenous landlord that is our operations partner. Then we have Prairie Harm Reduction doing our support staff. So they have a robust harm reduction lens. We have Saskatoon Health Authority. that has nurses embedded in our program with our case management team, and they're the primary care team. Sask Housing Corp is the ones that have leased us the building. We have Westside Community Clinic providing our primary care with the nurse practitioners for primary care clinics, opiate agonist therapy, and the prescriber for our managed alcohol program. We have Saskatoon Health Authority with a psychiatrist that we've been able to stay connected with due to our relationship. So he's providing community consultation for our participants and also runs a community treatment order clinic and has matched his service with the way in which the flexibility of our program is how he manages the CTO clinic. And then we have MedV, who has community paramedicine, so that we can offer a 24-hour health perspective to our participants. So we have Key Connect Village running 24 hours. We have Mobile Crisis running 24 hours. They're able to communicate and provide that continuity of care 24 hours for our service participants, which kind of aligns with the on-call pieces that Misty was describing in her presentation. So I'm going to I did enough talking, so I'd like someone else to talk about our program. So I do have a little clip, if it'll work for me. How do I make it work, Jason? Do I just click here?
Sure. Let's do that. Sure. Here we go. No? No. Nope, sorry. Let's go back. It should go. Unfortunately. Wait.
Journey Home has provided not only housing, but hope, healing, and community. Journey Home helps to eliminate the barriers to healthcare and addiction medicine. It allows folks in the program to begin their lives, and it allows us to see them as the beautiful, hilarious, and resilient people that they are.
My name is Jeannie Coe. I'm a nurse practitioner in Saskatoon's inner city, and I've had the good fortune of working with Journey Home for the past decade. They deliver an unparalleled quality of service for our most vulnerable, and I've learned a lot from them in how to really be client-centered and trauma-informed. And beyond just an excellent clinical service for residents of our community, they've also demonstrated a willingness and a leadership to partner across organizations and sectors, and the synergy of those robust partnerships have resulted in very unique programs that have supported some of our most complex and vulnerable people. But the synergy of the partnership also contributes to resiliency in the health professionals that make up that partnership, and that's really important in this time. So I'm just grateful for that opportunity, and something that I hope for, have dreamed of, is that we would see this service enhanced or scaled up or rolled out to our rural and remote populations in this province, so that everybody would have equal access to an excellent program like Journey Home.
But the main concern really worked from taking me off the street. The support I've been getting from the people who work here has done lots for me, especially when I needed something really badly. Making my life a little bit easier from making better choices. And the program does work. Like, it really helps a lot of people. The shady things are sometimes that we don't give staff enough credit that they deserve. I just think that people who, in this lifestyle, like there should be more people who've been there, changed, and get a chance to have someone working with people like us. And the program is really great. I like it. So,
They can say it way better than I can, so I thought I would give them an opportunity. But they are champions in this work, and I appreciate that they've been willing us to partner with us. So some of the meaningful outcomes that we have found through these partnerships is from our quality of life surveys, participants' feedback. So 90% of folks deem that their food security, so that's consistently having enough food, was increased by 90%. Food quality improved by 88%, sleep quality 85% overall mental health improved, and 85% people felt safer. One of our participants, Lawrence, stated, "Good place, we need more places like this." So current participants at Kikanak Village, our home, have lived in their homes for an average of 1,042 days. The 3 participants, the longest tenancy with Kikanak was in their homes for 2,000 days. This is just an overview of our emergency service usage. So we deem that someone, their pre and post data, so that's program entry dates. So the moment in which we are able to house you is the moment when we start tracking this data. So the first 40 participants in the year in our program, so you can see how we have emergency room visits and the costs associated with that. So for 40 persons, and we're at approximately 80 persons now, was $800,000. So there are significant outcomes in building partnerships, and I think that they're worthwhile and working smarter in this climate to develop those. So what has worked for us? I would say we have a strong foundation. So Saskatoon Crisis Intervention Service is a nonprofit community-based established in 1980 with the mission to be committed to meaningful outcomes in using service integration. So inside our program, we have service integration, so between mobile crisis, the police and crisis team, and our case management team. And then we also have continuity across Saskatoon. We have an integrated service continuum for those with severe and persistent mental illness and substance use disorder and chronic homelessness, from the primary care team of the case manager and a registered nurse, with availability after hours support with a crisis responder, as well as a police and crisis team. So that service integration is integral in how we get it done. And I'm going to be frank, our team does whatever it takes. I have a gritty, grindy team of humans that are passionate about this work. They've been with us for a long time, and they do really whatever it takes. And then from that, we are always looking for folks in the work. When we're out at community partnerships and I see someone who's doing really passionate, exciting work, I figure out, is there a means that we can partner? Is there something that you can strengthen our service in some way? Because that passion transcends your teams. Just having those voices and those folks that are really engaged in the work that they do really is advantageous. Now, what can get in the way? I think we can lose the reason why we're doing this work. I think we can forget. I think we can get into some challenges and forget what we're best at, and perhaps become overburdened and try to do too much. I think there's obviously financial reasons for that, but I do think it's a good idea to recognize where your strengths lie and see where you can leverage or broker others in this partnership and strengthen their agencies as well as your own. I think that lots of folks in their agencies have a lot to offer and maybe are siloed out in those blocks and could offer something else to another agency that would really strengthen their practice. So looking at program drift, which can happen, we can take on too much. We can't be fully aware of the strength and limits of your partner agencies. So really getting to know your partner agencies. What are their limits? What are their strengths? Are you setting expectations that you're not aware that you might need to clarify and communicate those? And then leading with obviously honesty and integrity and having core guidelines and values that align with that. Now, understanding partnerships. So I think that although we feel, and as a social worker, clear is kind, communication is clear, is it as clear as we think it is? Never. It's never as clear. When your frontline staff is noting that there's issues, is it the person or is it the process? And kind of looking at processes and how you may be able to strengthen those and support your teams better. To clarify those partnerships so you can get out of each other's way and stay in your lane and strengthen each other is kind of what I've learned through this work. It's no small feat to do that, but there are so many more resources available through partnerships if we need to pursue them, and having those clear roles and responsibilities. And are there partnerships in your home community that perhaps through the years that maybe the relationship has become strained? Maybe there's opportunities to reach out again and say, you know, let's start this over. There's something that happened in the past. We have long histories in community. I know that there's some agencies that have struggled, and, you know, we can come back from that, because at the end of the day, we're looking at the why. And I just wanted to show my why. There's pretty fabulous people you get to work with. There's pretty fabulous people you get to know. And I think we need to celebrate a lot more our small wins, and in this work, it's nice to feel that way. So as you leave the session today, I'd like you to think about your own home community. Are there agencies that align with your organization's missions and values that you think you would want to reach out to? Is there an agency that you can reach out to this week? Are there champions in your own backyard? Thank you.
Thank you, Tammy, for that presentation. I really like the monetary part, that you were able to track that. That really lets a lot of people understand the importance of the work. Thank you. And our last presentation, Leigh Stratton, and I'm just going to tell you a little bit about her. With more than a decade in the housing and homelessness field, Leigh has worked frontline, case management, and behind the scenes in policy and funding proposals. Leigh is currently the team lead for the Housing First team at Options Housing and has been working with her team for 5.5 years. Welcome. Thank you.
Are you able to?
Yes, let me get that out of the way.
Thank you.
Sorry. There we go. And yours should be here. Right?
That's the one.
There we go.
Thank you.
And here we go. No? Is that it? Right there. Nope. Solid.
Perfect. Okay. Hi, everybody. Thank you very much for having me. This is my 5th Alliance conference that I've gotten to attend, and it is the 4th one I've presented at. But this time, I felt like I might want to do something a little different. In previous years, I've done presentations on programs that I've contributed to, programs that we've finished completing, and looking at what we've done well and what we've learned. And I thought that maybe this year I would do something that involved a little bit more of a personal experience that I've had over the last few years. And it involves being a little bit vulnerable, which I absolutely hate. I hate more than anything. But these sort of presentations are the ones that I always find touch me the most. They're the ones that I take the most from, and I'm able to bring information back to my team in a tangible way. So I'm just gonna go for it. I'm just gonna do it. So something just hasn't felt right for a while. Like maybe there's something wrong with me. And I know for those of you who know me, you're thinking like, yeah. But I mean something new. And it's been affecting the way that I go through my personal life, and it's definitely been affecting the way that I work. And it's, I think there was this thing that happened like 4-ish years ago. You might not remember, but there was this whole like pandemic that I don't know if I have to jog your memory, but may have affected you guys. It certainly affected me and the way that the way I do work and the way that our team works together. And so, the format of this presentation, like there will be useful information coming. I'm just gonna talk a little bit more about myself because it feels kind of nice, actually. So I remember the day that the proverbial shit hit the fan. It was Friday, March 13th, Friday the 13th in 2020. And the day started out like any other day. We're a Housing First team, there's about 10 of us. We start our day at the office. We have a morning meeting. And we all sit down together and we go over what we're doing that day, who needs help with what areas of town we'll be in. And then we all kind of go off and do our separate thing. But there was like a weird anxiety in the air that day. We knew things were coming. And so after our morning meeting ended, we all went off to work, and we got an email shortly after lunch from Catherine, our executive director is here. And the email was of modest of length. It was basically, and I'm paraphrasing, though I did look at the email, I did go back and look. It said, effective immediately, don't come into the office. You're not to be transporting clients in your vehicles or the work vehicles. We are not to be meeting clients in person unless it's an extremely urgent situation. So in an instant, the way that we delivered services to our clients did a complete 180. May I have my water? See? Oh, just the other one. I should have grabbed it. Did anyone else have that experience? Like a complete switch from one day to the next. And so it really shook us to the core of how we did our work, because what we do as Housing First practitioners is it's literally meeting people where they're at in the community, physically where they're at. Lots of our clients were in shelter. Some of them were sleeping rough. Some of them were couch surfing. Some of them were housed. But across the board, a good chunk of folks did not have access to phones, consistent computer access, that sort of thing. So getting messages to clients, we often relied on shelter staff to pass those messages along, or sifting through the crowds at a drop-in to see if we could find who we were looking for, and that suddenly became not an option. And then the drop-in centers themselves, the places our clients frequented to get important stuff for their day-to-day lives, all closed their doors at the same time. And so I know that this was never the intention of any service provider, but it really did feel like our clients had been just abandoned. We just, well, good luck, And at the same time, I'm really, really grateful to be working for an organization that values, our health and our safety. So there was this cognitive dissonance there, because we didn't know what we should be focusing on, and nothing felt right. So that was a real challenge. In preparing for this presentation, I didn't want it to be all about my experience, even though it sort of feels that way. So I did talk to, some other HBCMs. I did some formal and informal interviews with some friends from CMHA, from ACT teams, from the Royal Ottawa. And they all said basically the same thing. It was kind of like a collective existential crisis that we were experiencing together. And so, I don't need to keep going over what happened in 2020, because you were all there. And, things opened and things closed, and services adjusted how they were doing their service delivery, and then they went back to normal, and then they all closed again, and then some places closed their doors forever. And that was, for the sake of our clients, it was a huge, they took a huge hit there. And then we also have to think about how it affected us in our homes, because we were all working from home. Some of the things that were going on there, I remember a few times I would take a phone call and someone would ream me out. Because as a frontline service provider, we're often delivering news to clients. Sometimes it's not good news. Sometimes it's the service is closed again. And so more than once I would have someone yelling at me on the phone. And generally when that sort of thing happens, I'd hang up the phone, and 10 people in the office would come to me and say, oh, geez, that sounded like a rough phone call, are you okay? But when you're doing this at your kitchen table by yourself, or with your kids in the other room, there's no one to go to for that. Another time, I remember I was on the phone and someone was in crisis, and my daughter was outside playing. And at one point, she started crying. And I was like, oh, what do I do? Oh my God, she's really clumsy, so it's not a huge deal, because she probably just bumped her head for the 4th time that day. But for somebody else who doesn't have a clumsy child like I do, that sort of thing, you can't hang up on the person in crisis, but you have to go see your child. It was a real tough time. Luckily, things have improved, and we've gone back to what we do It feels very, very pre-pandemic these days. And I think we're among the lucky ones because we still have our jobs. We haven't had to reduce our capacity. We've had no major funding losses, no changes to service provision. And I can't say the same for a lot of the community partners that we deal with. So, big picture, we're really lucky. And even pre-pandemic, the system was difficult to navigate and there were always hoops to jump through. But I don't think we realized how much easier it was in those days versus how it is now to get the same sort of thing done. I work with an amazing team of people, and every day I see them working like 10 times harder than they ever used to like accomplish goals with their clients. And they accomplish miracles, but there was a time when it wasn't this hard. So anyway, there is something wrong with me. And I see this as there's something wrong with a lot of the folks that I work with and the folks that we collaborate with in the community as well. People are a lot more isolated. I find that, people don't feel as effective as they used to feel, even though that they're working 10 times harder than they ever did before. Sometimes the motivation to do things isn't there. I wrote down that my empathy wasn't what it used to be, which is kind of actually not true. If anything, I feel like I'm more empathetic than ever before because I worry more about the clients that we have on our caseloads. But also sometimes my phone rings and I think, like, what? So it's a bit challenging to kind of figure out what's going on. And so I think everyone is going to say, geez, Leigh, you sound pretty burnt out. But maybe it's not burnout. Because as social workers, we know burnout. We are well educated on what burnout is, and bubble baths aren't for me, but I do the equivalent. I've got great work boundaries. I turn my phone off at the end of the day and I spend the time with my kids. I've put measures into place so that burnout is something that we talk about on our team on a regular basis. We do debriefs. We talk about this stuff. There's no shame in it anymore. Lots of coworkers have taken time off for weeks or for months, depending on what they needed. I know that myself, I've spoken to my doctor about it and specifically to a mental health professional about it. It just, for some reason, it doesn't feel like it's fixing the things. So maybe it's not burnout. And I'm gonna click to the next slide. Have we heard of moral injury before? I see so many nods. See, I had before, but something about the name kind of gave me the icks. And I know that sounds kind of unprofessional, and I don't mean it that way. It's just the whole morality piece had a bit of, I think as social workers, we like to say ethics, maybe, or morality often comes with a religious connotation or a spirituality piece, whereas ethics feels a little bit more of a professional term. But the term moral injury is out there in the research, and it's a legitimate thing. So if you don't mind just getting past the icks, if you have them as well, then taking it from there. Switch to the next slide. So I'm just going to hit the play button here. Oh, there doesn't seem to be any sound.
So that's an act of commission, you've done something, or fails to prevent, an act of omission, you've failed to do something, or witnesses acts that conflict with their values or beliefs. And then it goes on to say experiences that might lead to moral injury in healthcare workers include having to make decisions that affect the survival of others or where all options lead to a negative outcome. Having to balance one important set of values, for example, caring for patients with an infectious disease, over another, protecting family members for infection. If you just even start to look at this, even those first 2 points, if we take out the healthcare examples, these are things that impact on us as social workers. Social workers are always balancing different sets of values. We're always making decisions that where all the options might lead to a negative outcome, and we think about how can we manage that. So these are things that are happening for all of us. Allocating restricted resources to severely unwell patients. Well, if we take out the 2 severely unwell patients and just allocating restricted resources, that's massive for us as social workers. Balancing their own physical and mental health needs with their duty to patients, that's huge for us. How do we manage our own self-care when we've got this overwhelming workload? So this is stuff that's relevant to us as much as it is to help.
Oh, that got cut off. But I think that the point is the same, that, you know, they're discussing specifically healthcare workers here, but it's very easy to apply this sort of thing directly to the work that we do with our clients and our service users. And there's more and more research coming out about this.
When someone engages in, so that's an act of commission, you've done something.
There we go. So just to give a quick history, I won't, because I'm not an expert in this, there is so much content that you can find online that I don't want to bore people with the history of moral injury and where it came from, but it is interesting to learn that it started as, in the context of research for war veterans in the mid-1990s. And this is where most of the research is focused until about the last decade. What's that?
Did it go back?
This is the next one, but I'm waiting for the sound to kick in. What's that?
Moral injury. Fenton and Kelly then go on to say, we believe the concept of moral injury may be applicable to experiences that are not as extreme or potentially acutely traumatizing as experiences in war. In drawing on these concepts, we want to make it explicitly clear we're not likening the experiences of professional social work practice to the horrors and traumatic events that soldiers may experience, whether within or out with the wartime rules of engagement. However, we do believe that practice in many professions can expose professionals to situations where they may experience transgressive acts that go against deeply held personal or professional values. This exposure to transgressive acts might lead to the development of moral injury, albeit of a lesser order than that which is experienced in contexts of war. Now, don't forget, that was written in 2017, way before the pandemic.
I cut her off there. I felt that it was important to add that piece in as well, that we are not comparing ourselves to soldiers in active duty, but the language is so very similar that, we're fighting this fight together and that we're...
The essence of moral injury.
I also felt that it was really important to draw a definition, draw the differences between something like PTSD and a moral injury, because PTSD involves a direct threat to someone's life. When a morally injurious event, it's more of a threat to one's beliefs or professional practices. And it's also important to point out that moral injury is not in the DSM. No one talks about, or it's much less talked about than things like PTSD or things like burnout that are, what's really, really common to, and, good to talk about these days. So in order for a moral injury in order for an action to be a moral injury, 2 factors need to be present: compromise or a violation of a deeply held value, and that the stakes must be high, so they can lead to serious physical or psychological harm. And maybe it's hard to take that definition and apply it to the things that we do, but, a compromise of a value that I felt was really important with the work that we do was making that face-to-face contact with clients and seeing them in the community. And the stakes are high, because when the food bank door closes and we can't take our clients to get food, the stakes could lead to physical or psychological harm. And then the common elements of a moral injury. So complicity in the wrongdoing. So when one believes that they're doing wrong, but they don't have the power to change the situation. And, when we were dealing with the pandemic and the constant changes to what was going on, We did have input, and we were allowed to, discuss what was going on. But bigger picture, it did not feel like we had any control over what was going to happen next. The wrongdoing associated with professional values, when a professional standards of care or service delivery are impossible to carry out, that's bang on. And the care or services that were being rationed, when the services and supplies are being rationed, when the resources stop being made available, when the doors close to the resources that we need the most. That felt like a huge moral injury to me. And I'm sure everyone's familiar with the Canadian Association of Social Workers Code of Ethics and Guides. The first principle on there is respecting the dignity and worth of all people. So when we stopped making these services available directly, it felt like a clear violation to me. But these are things I didn't think about until the last year or so, because everything was so all over the place. No one knew what was going on. So it's really only just dawned on me that this might be affecting other people as well. So what do we do about it? It sounds to me, and I am not an expert, and there's a lot of information online, there's a lot of resources out there that are much more thorough than what I'm going to give you. But it looks to me like what we need to do is be able to talk about it, to recognize it, to recognize that this is not just a burnout. It's not something we can take an extra long weekend on and feel better after. And I'm really happy to see that a lot of the factors that could be mitigating the impact of a moral injury are things that our team are already doing. So, team working in a sense that you belong to a community, a strong reflective culture, good quality, emotionally supportive, reflective supervision. This is a really big one. You have to be able to have these conversations with the people you work with and the people who are supervising you. In-depth reflection with a particular focus on feelings and emotions. That's a hard one at work. It's hard to talk about feelings and emotions because you don't want your management to see you in a different way. So sometimes it has to come from your coworkers, from your team, or from your person at work. Education about the potential of moral injury and permission to talk and explore the depths of the injury with colleagues, and a clear recognition of the importance of the work and the value that is being placed upon what we do. So I think that the team that I work on is really, really good at doing this, but we haven't put it in this context yet, and that's something that I'd like to, that we plan on bringing forward for the next couple of debriefs we're doing. I'll end it off with this quote. The best support that we can offer right now is honest, open conversations so that people feel heard and validated in their experience. That is what will help get them through. Once we are through it, there will be different work to do. Whenever I have spoken about moral injury, there have always been people in the audience who have breathed a huge sigh of relief, and I saw people do that, because there is a name for what we're feeling. And again, the name gives me the icks, but it does very accurately address at least how I'm feeling and how a lot of people I've spoken to over the last few months are feeling. It's no different now. We really need to find ways to talk about how we're feeling, both good and bad, so that we can bear it, and that silence will do the harm of not talking. So I guess the reason I wanted to present on this is so that you might be able to take it back to the folks that you work with. And maybe people are ready to start talking about it, maybe they're not, but it certainly isn't the only thing that's ever happened that could be a cause of moral injury. When the opioid epidemic kind of started and the overdoses were getting really common, I worked at the shelter, and I remember the nurses were reviving clients like one after another. And I remember thinking yeesh, that's gonna be with them for a while. And it was. And this is something that our team of nurses spoke about all the time. And so, that was their moral injury. I'm sure that everyone in the audience has something that they can point to as their moral injury. And at least for me, the COVID pandemic and the changes to the services that we provided, I think it's mine. So bring it forward. Talk to your teams about it. See if we can get through it. and then be prepared for the next one. Thank you.
Thank you, Leigh. Thank you for bringing that to our attention, moral injury. And I really think about some of the questionable things I had to do during that time.
Yeah.
Definitely. Thank you. At this point, we've seen all three, and we're willing to take some questions. Anybody, feel free to ask questions, have hand up. I will try and repeat it for, we don't have a mic to discuss or to give to you, but I'll try and repeat as loud as I can.
For sure, I just want to say thank you for that presentation. I know you don't like it to get vulnerable, but thank you for getting vulnerable.
Hate it, but it seems to be the only way, you know?
Yeah. I have a question for Misty. I was hoping you can speak a bit more about your damage fund that you were talking about, because here in Ottawa, we do have a landlord damage fund. The way that it works is landlords have to kind of do the work to get those funds. They apply to the city, and they have to get quotes. And they're the ones filling out the application. So I'm finding out for us, whenever, we're kind of selling like our program and we're talking about damage fund, landlords just don't really care.
We spend a lot of time putting up barriers and a lot of work for ourselves. We need to ask for damage funds in our funding, because if something breaks and I know my client did it, I call my window guy, or I call my door guy, or I call my drywall guy. He comes and does it, gives me an invoice, and I pay him. My landlord never has to do it. The issue with too much work is that in the non-for-profit world and the government world, we make things too complicated. I am a literal social worker who has 2 degrees. Trust me to spend the money on the things I'm supposed to spend it on, and I'll even give you receipts. Do you know what I mean? Like, we do the work, and there's a lot of checks and balances in place. Like, we know what our clients are doing. So, like, I understand why they do programs like that to give them to, but things like that make it complicated. So my suggestion would be to you, would be to argue that some way to make it less cumbersome for landlords, because if people aren't using it, then it's kind of pointless.
I can speak to that directly. We build damage deposit, the damage pot, into the funding request. We will not do housing first without a damages fund, period. Will not do it. Sorry, don't want your money.
Sorry, I can go here and then here.
Okay, sure. Hi. I really love this presentation on moral injury. To kind of like relate it to my experience, I lead a couple different programs, one of them being an outreach program and one of them being a housing support program. And I was one of those people that breathed a sigh of relief because I felt like you were really describing how I've been feeling. One of the things that I struggle with a lot is kind of making the tough decisions, whether it's like tenant selection, selecting one tenant over the other, even though they both have really high needs, or making decisions like, no, we don't have the financial ability to support that individual right now, or whatever it might be. And I just wanted to know if you have any support or any advice on how you kind of deal with having to make those decisions and how they also affect your team. I've seen like a lot of responses to some of the decisions that I make have been like negative for good reason. I mean, we're picking one thing over the other and making these tough decisions, but I've had a really hard time navigating that.
In some of the research I did, they talked a lot about how difficult it was, at least for healthcare workers during the pandemic, because all of the options in front of them are going to lead to bad outcomes, and that having, there's a lesser effect when you're choosing the one which will have the least bad outcome, but that is the unfortunate reality of sometimes the decisions we have to make. But it talked a lot about accessing your team when making these decisions, talking it through, making sure that everyone is on the same page, and then in the future, taking that decision that you've had to make and trying to affect change so that you don't have to be put in that position again. Like a lot of what they talked about in the like getting past the moral injury stuff was how it will eventually make you stronger if you get through it and learn from it. And so I think if you're able to take that and turn it into something positive, that's probably the best way to, which is easier said than done, but how to move forward.
I think, and then I can go.
Yeah, thanks. Hi, I'm Ariel from Peterborough. Thanks to everyone for presenting. I guess I have a two-part thing. One is like very practical. How much do you allot per unit in damages fund? Like, is it 5,000? Is it 10? Just a number, because we've tried in our municipality, and then reaching home was like, they're not using it, we're not gonna use that money, because we can't budget for it. So just that, and then the other piece is more a comment of like, this gives space to the grief that I needed to feel about the pandemic and how all of a sudden it was too dangerous for any of the workers to be out and about. So, you know, just, okay, everyone, you just have to fucking figure it out. How difficult that was.
Well, and
right?
how,
I'm just like,
how quickly we
for
wanted
safety,
to.
we're not gonna meet with you in person, and that was, it's like, the context that our keynote talked about today, like, I think this provides some context for some of what's happening maybe 4 years later.
Yeah.
That people went through, like, they got served, they were chucked to the curb, then they got served, then that was all clawed back. Like, we've all been through a lot, and I really wanna thank you for
Thanks.
making space.
Well, and we all quickly wanted to get back to normal. We were all back to normal, back to normal.
That wasn't
But
good
like,
either.
so we're all scarred for life. We might not be normal yet. But how much money?
For the money thing, I don't know how she did it in the funding thing. You'll have to ask her. But this is what I do know, is that we don't say this person's gonna do this person's gonna do that, this person's gonna do that. The reason we don't do that is because it is absolutely impossible. We have housed people who, through all the documentation, all of the assessments, all of the, living in an encampment type environment interactions, this was a HOPE team level individual. Imagine when you get them housed and they stabilize and suddenly they actually are not a HOPE team level. We have other people who, present really, really well. And we think maybe this is not going to be too exciting. And then it's super exciting. So, it's really hard to gauge. We have people who, they are our wild and feral, carefree service users and never had damages to their unit ever. And then we have people who, present really well and they have 5 windows busted out times 3. So it's absolutely impossible. In Housing First, there's going to be so much stuff. I think that in communities, when you're doing the work and you're good at the work, I think that we have to trust in our ability to do the job and that the funder's going to see that they're doing it, they can do it. Let's trust in them to use the money where it needs to be. And then she does the number stuff.
So we roll it as damages and client support, so that, and we've never not spent the money. Because
Sometimes it was really hard to spend the money. Yeah.
yeah, when it's rolled as like damages client support, you can then say you have something, and I averaged it about $1,000 a month per person we were expecting to house for damages / support. So then you have that kind of wiggle room that you can say, okay, you're not having damages. What else do you need? And I think for us, for HOPE Team, the goal is maintaining housing. And what I often say to Misty is, tell me how spending this money on this, make sure they stay housed.
And I'm really good at that.
Yeah, baffle them with bullshit.
I had a question for Misty. So I oversee transitional housing for women and children in DP. I'm very intrigued by these units that you spoke about, for those women in volatile relationships and side-by-side units with their partners.
Not side by side.
Close?
No, they're private landlords, scattered site. So For instance, one of our clients, those two individuals, it's like within walking distance, close enough that they can visit easily, but not close enough when they're having one of their explosive yelling fights that they could, like, when you go for coffee with them and bring them home, they, like, you know, have to walk to, like, get some of that steam blown off. But like in similar communities, like we meet with people in community and and we're not like, oh, we have this unit for you here, let's move you into there. We're like, where do you want to live? And like, what kind of things are you looking to do? And we have those conversations. So we kind of have quadrants of the city. So a lot of people will be like, oh, I want to live north, or I want to live west, or, you know, that sort of thing. And a lot of people in our community stay homeless in the communities they're from, or they know, or they want to live there. They do go to our like high service areas, which is typically in most cities like downtown. But yeah, so it's kind of, you know, in those situations, we have such, the relationships we've built with our landlords now, they're just offering units all the time. And like, I can't keep up. But so typically what will happen is that, you know, how we kind of look at that priority list and we'll be like, oh, this person is coming up. I know that when I house this person, I have to house this person. So I'll kind of keep my eye out for like 2 units that are coming up that are relatively, but they're private landlords and it's different landlords and it could be, you know, it could depend. So.
That's really interesting. Yeah, thank you.
No problem.
I just want to say thank you to all 3. Amazing. The question is for Tammy. Tammy, you spoke, you said when you see a community partner and they have maybe, I may have misunderstood, but they have a frontline staff or they have someone on their team that has some grit and really doing great work. Be creative to partner with them. Can you please provide me with a quick example? Like, do you approach their leader or do you start having the conversations with them?
I wouldn't, I think what we've recognized is that, so we have interdisciplinary teams on our team. And so some of those folks come and do some cover-off work or casual work for us. And those folks have demonstrated some of the passion and interest in the work. And we've kept them alongside. But in other areas, I think we're looking at partnerships and when we're going to community agencies around where we're seeing some gaps or where we're seeing where we want to build up and enrich and make our service more robust, I'll start looking out to those partners and seeing what memorandum of understandings we might be able to come together to build some capacity, whether that's from a community-based organizations. And I think what we've been learning a lot in this, what I've been learning a lot at this conference is how we can get smarter with the stock that we do have in community, and we need to probably get smarter than the strategic planners who are bringing down the funding when we need to consider joint proposals and consider ways that we can build each other up rather than kind of pushing someone else's program, not able to build that up. If we came together, could we build on that together in a good way? So I think that is the wave of our next kind of work, and I'm going to continue to kind of build on that. But yes, I think you see folks in community and you can see those champions. I think in your own community, you're like, that organization does great work in this area. And I've never thought of maybe partnering, but are there things that we can do together that would really make our clients and our participants' lives improved? And you can kind of see the outcomes when you think of those ways. But yeah, that was a long, convoluted answer. Yeah.
Any other questions? Any word comments?
Just follow up for that one quickly.
Yeah.
So would you recommend only partnering with organizations that are leading in the field of the work that you're doing, or even with organizations that are doing similar work to you but are not that strong either?
Yeah, I think you need to know, what do you do? Because I think it's easy to start doing things that you didn't do before, but now you do this too. But do you do that too? Or are you needing to because of this, that, and whatever? And would that organization be better served if they had you alongside to do that work as well as they're already doing, and that you have an opportunity. So I think that, yeah, and I think it's hard, but we've really tried to stay in our lane as serving what we call as the hardest to house, hardest to serve, and the most acute. And then recognizing where maybe someone's running an organization that's what's deemed medium acuity, but they do need more service coordination. So maybe there's opportunities that we come alongside to do some soft transfers and work with them at their housing continuum, build them up, give them some stability, and then see where that goes, right? So I think there's just a lot more opportunities than we recognize, but it's not easy.
Okay. Well, all right, I think that's it, and thank you.